So we have our conceptual framework of we've got, for example, motor vehicle accidents, and we've got a range of determinants which might actually contribute to eventually somebody having an accident and somebody actually dying in that accident. One of the other ways to look at it as we move along, we in this process, health promoters have the opportunity to actually try things out to see what effects. And so this raises the issue of evaluation. Evaluation is a very important part of health promotion, and we can see here from this diagram that we've got a range of interventions that have been put into place. So we've got, and then we're tracking basically road fatalities and hospitalizations. Now, hospitalizations are fatalities are tragic. It's clear, and they do cost a lot in terms of money and in terms of a range of other social factors. Hospitalizations are often not as tragic or permanent, but still there's a large cost to the community in terms of both money and emotions. So you can see here over this period of time from 1993 to 2002 there was a real reduction in road fatalities, but you can see here that hospitalizations were actually remained pretty much static over this time. But in any case, if we look at the various interventions, we can see that there were a range of strategies that were developed and implemented. We've got actions like we've got the lower speed limit in the residential areas. We've got speed camera expansion, which seems not to have flattened the line, but clearly when you look at these figures, the thing is, at least we haven't seen an increase in the fatalities. So whilst it's been static, that's not a bad thing, it's a good thing. At least it hasn't gone up. So we get other things: Holiday Road Safety Period Trial, School Safety Task Force, Q-Ride Trial, which is an intervention designed to train motorbike riders better in terms of their skills on the road. So essentially what we were able to do over a period of time is look at the various interventions to see what has worked and what hasn't worked, so we can maximize future action. So if we're looking at building a public policy, so let's look at this in a health promotion framework. Building healthy public policy, the various factors that have led to this decrease in road fatalities. For example, drink driving and speeding legislation has changed. There's an enforcement of speed limits to reduce people's dangerous speeds, seatbelt legislation, and also crash testing programs from the industry side of things, so that people who have accidents in cars are actually safer in their cars. We also have, from a public policy perspective, alcohol management in pubs. When roads are built, we need to make sure that there's a road safety aspect to it. The responsible serving of alcohol, so making that link between alcohol and motor vehicle accidents, and also looking at making sure that cars that people drive in actually are safe. If we look at creating supportive environments, the second element of health promotion, we can see that there are areas, black spots are areas where there's more accidents than other areas on roads. So these black spots need to be identified, and then the problems actually worked out and solved. Car safety design, so airbags. The improved street lighting and traffic management means that the roads again are safer, and this is done through an environment type approach to things. The social environment, looking at the social environment, so starting to basically have this cultural move towards people who drink and drive are being antisocial. So if you drink and drive, you're a bloody idiot. If you speed, then you're basically making yourself into a killer. Every K over is a killer. and driver fatigue, so stop and have a rest. These three ideas are basically trying to change culture. So there's culture change. So changing the social environment is actually quite an important aspect. And also, well, what do you drink when you're out? Having alternatives so that people can still engage in the actual activity without becoming a danger to themselves and others. Strengthening community action. So basically, um, neighborhoods actually advocating for better facilities. So, if, for example, we're trying to get people to ride bikes or to use some other form of active transport, um, these facilities need to be there, otherwise people won't use them. We need also to identify who's at risk. So certain suburbs might be at risk, or certain age groups, for example, school children might be at risk. But all this relates to strengthening community action, so enabling communities to form action groups and take action, lobby politicians and others to make the appropriate changes in their particular neighborhoods. And we can see examples of this, that road safety is actually quite an interesting phenomenon, because the responsibility for road safety actually lies largely outside the health department. And you can see here that the various this is the examples of the road safety alliances. You can see that it's fairly evenly distributed amongst a range of different stakeholder groups. So individuals, but we've also got fleet managers who look after cars. You've got community groups. You've got a road safety committee, the industry, so the motor vehicle industry, the media, and government. So we've got a range, a good intersectoral mix of various stakeholders, which is again an important element in health promotion. Developing personal skills was another element of health promotion, and this is fairly obvious. Improving driver skills, making sure that people know that drinking too much alcohol and driving is bad, but also knowing how much alcohol is too much alcohol. Changing the culture to start recognizing that people who drink too much are behaving antisocially. So try to reduce that particular behavior. And as I mentioned before, the Q-Ride program, which is basically trying to upskill the new motorbike riders that are taking the roads. When we think about making changes to either personal behavior or also to the community action and also social environments, we need to consider what the community attitudes are. And this is quite an interesting slide, because this actually looks at the evidence, so what actually causes crashes, and what the community perceives as the major issue. So basically they're saying that this is probably the interesting paradox here, that alcohol actually is involved in the most fatal car crashes, and yet community concern is high, but not as high as, say, this, which is basically driving without a seatbelt. Now you can see here that the program on seatbelt wearing has been quite successful, and so basically people not wearing seatbelts are far less of a contributor to fatal car crashes. However, the community concern about seatbelt wearing is actually quite high when you compare their concern with alcohol. So these are the sorts of paradoxes that health promotion needs to try to address. So basically, you take away from this these data is you take away that the community actually needs to be made more aware, and their opinions about alcohol being involved in fatal car crashes needs to be enhanced, so that the community actually becomes more involved and more aware that that's the case. Now, this last element of health promotion, when we're thinking about motor vehicle accidents, road safety, etc., how do we actually reorient the health service? Well, We need to, one way to do it is to have quicker and more effective responses from road trauma teams because, for example, when someone is injured, the quicker we can get them to hospital into appropriate treatment, the better chance they have to survive. So that's sort of not preventing the accident, but clearly enhancing outcomes from accidents. But on a more preventive level, reorienting health services, so getting the medical associations involved in advocating for road safety measures, because let's face it, the people in the emergency sections are the ones, and also the paramedics are the ones who actually have to witness these very grim stories. The other strategy one might use is to use another important coalface activity, and that is to use ambulance officers to raise the awareness of dangers of drinking under the influence of alcohol and also speeding. Um, and finally, we've done this example on motor vehicle accidents, but the challenge for this week is to actually take a health promotion approach as governed by the Ottawa Charter, and look at the issue of childhood obesity to see if we can um, investigate those 5 key elements of the Ottawa Charter to see if we can come up with a mix of strategies that might help us to alleviate this growing problem.